So that is about the weight. So if you see the how the weight is going to be increased from the baby birth onwards to until the age of like 1 and 2 years, how it will be. Normally after the baby birth, immediately within the 1 day, so they may chance to get the weight loss. How much the weight loss? 5% to 10% of the body weight. So that means if the baby weight is like a 3 kilo, so is going to be around the 10 percentage, mean 300 grams, around the 2.250 grams to 300 grams is that they are going to, the baby is going to get the weight loss. But within the 1 week, the baby is going to get the weight gain. The weight is going to return within the 7 days to 1 week to 10 days. So if you see the calculations, so within the 4 months to 5 months, the baby weight is going to be double. So because of the baby growth, should be increased double weight within the 4 to 5 months. For example, if the baby birth 3.5 kilo, so after the 5 months it should be 7 kilos. So if the baby weight is not is like is 7 kilos, that means double, not it's not the baby weight is not double within the 4 to 5 months. So it may indicates having the baby growth is like a is a deteriorated, or maybe there is no proper growth. So for that reasons, the mother and also has to take care of the child about the nutritional, or maybe if they're having any health issues, so they have to consult the doctor, and also they have to rule out the causative factor. So until up to 1 year, the baby weight is going to be the triple to the birth weight. So if the 3.5 kilo at the birth time, in the 1 year should be 3 times around the 10 kilos, more than 10 kilos should be there. So and also in the 2 years, it should be 4 times. If the 3.5 kilo in the 2 years, the baby weight should be 14 kilos. That's a 4 times should be increased. So if any deterioration or if any growth disorders, so they may chance to get the less weight, or some kids, babies may chance to get the overweight also. So we can compare easily. So which one is the normal weight, which one is the lean, or maybe the malnutritious, and also maybe is the overweight, and also obesity also we can found out. So according to the some standards, so every month and also age also should be different to the boys and girls, the male baby and also female baby. So here the chart is there. According to chart, we have to assess the baby and we have to confirm where exactly they're having the problem. So that is about the weight. So and also who are going to get the risk factors, especially okay, who are going to get the more like weight is going to be altered. So this is going to be if anybody having infection during the pregnancies and are not gaining enough weight during the pregnancies, the previous pregnancy with the low birth weights, smoking and alcohol and drug use, age less than 17 years or more than 35 years, or maybe is African American backgrounds. So these people, if anybody having these risk factors, they may chance to get the altered weight growth. So coming to the weight of the baby, so if you just now we discussed the 3.5 kg weight the birth time, so 1 year should be reached to the 10 kilo. And also if you see the 5 years of age growth, so it should be from here it's around 20 kilo. So in the age of 5 age, so should be is the 20, and age of 10 should be is the 30. So if the age of 30, if they are not reaching to 30 kilos at the age of 10 years, if they're not reaching to 10 kilos, so we have to consult the healthcare professionals. So especially we have to rule out the what are the causative factors why the baby is not getting the like a growth, is because of the malnutrition or because of the overweight. So we have to rule out the causative factor. So if you see the weight gain, first 3 to 4 months, the baby is going to get the 20 grams to 30 grams for the first 2 months. So it's going to be increase. It's the first 3 months is going to increase every day. And also in the first year is going to be within the 15 grams to 20 grams the rest of the year. After the fourth month, so the baby is going to get every day is going to get the 15 to 20 grams difference. So average annual weight should be the 5 lbs. So that means 2.27 kg between the 2 years, and also puberty, that is the 1 kilo. So every year is going to increase the half kilo, at least minimum half kilo. But within the 2 years, so it should be around the 2.27 kilos. So this is the normal improvement, normal weight gain. So if anybody having abnormality, so we can rule out the causative factor. So coming to the height of the baby, how we can consider, so who are going to get the abnormality about the height. So normally height of the baby, average height is the 20 inches at the birth time. So 20 inches means around the 50 centimeters. That means half meter is going to be at the birth time. So 30 inches and also at the first year of age. So around 1 meter 20 centimeters. That is 120 centimeters at the birth time, at the first year time. Sorry, this is 30 inches, right? 30 inches, 30 into 2.5. So 60 and also 70 centimeters at the age of first year. So that is the normal average weight, sorry, height. And also at the age of 3 years, the average child is going to be 3 feet tall. And also is going to be increased. At the fourth year, the child height is going to be the 40 inches in tall. So double to the birth weight. If you see here, the first age is the birth time 20 inches. At the age of 4 years, should be is the height should be is the double compared to in the weight. It's a double to the only within the 3 to 4 months the baby weight is going to increase double, but height it should be at least 4 years takes place to double the height. The annual and also average annual height increases and 2 to 3 inches between the age of 4 years and also puberty. So up to this one, every year they're going to increase the 2 to 3 inches. That means around the 7.5 centimeters to, and also is going to be increased the 5 centimeters to 7.5 centimeters. So that is the average increment, average and also growth of the baby height.